Okay, number one, how big of a problem are overuse injuries in youth sports, and why have we got to this point?
It's a huge problem, and it's growing exponentially due to the increased number of kids playing sports that aren't supervised appropriately. So the end result is that they do too much too quickly, too soon, and their shoulders, elbows, knees can't withstand the stress of this repetitive activity. And just like any mechanical structure, it'll break down and cause problems.
I know kids are when they're hurting, they're probably going to try to hide the pain because they want to keep playing. How can parents and coaches monitor that and know when there might be the start of some problems?
That's a great question. I think there has to be a whole culture change and get back to the days where sports was fun and winning wasn't as critical as it is now. And win at all costs mentality, I think, has had some negative effect. I mean, we all like to win. We all are competitive, but to the degree that has been emphasized, I think, has had a negative effect on our kids, and it's not as much fun. If you want to see kids have fun, send them to a schoolyard or a playground, and leave them alone. They're gonna have a ball. It's when you organize them into a group and bring competition within and without of that group into the factor where people get into problems. We want kids to play sports. It's the mainstay against obesity and these other horrible endemic problems that we're seeing in kids. We want them to play sports, but we want them to play sports for their entire lifetime. We want them to be active their entire lifetime, and we want to keep them out of the doctor's office, out of the emergency rooms, and certainly out of the operating rooms.
Now, it seems like some parents really don't understand what the points that you just made. And take baseball, for example, and the Tommy John surgery, and you read a lot of articles where parents think that's maybe the fallback. If their child is injured, they'll just have the surgery and they'll be back on the field in another year and everything will be fine. Maybe talk about that type of thinking. That's pretty serious surgery, correct?
Tommy John surgery is a big operation. It's not a tiny little procedure like an arthroscopic operation is. And there are risks associated with it. And of course, you read about all the successes, but you don't read about all the failures. And you get a jaded opinion as to, well, that's if my kid develops that problem, there's a surefire way to fix it. And that's a misconception. Granted, it's a very successful operation, but it's not 100% successful. And that's not to account for the pain, the recovery time, the cost, and all those associated factors that go along with having a so-called successful operation. So it's best to avoid it. It's easily avoidable, very easily avoidable. But you have to be educated on how to avoid it.
Are there certain body types of children that are more prone to overuse injuries, or anything where maybe it would be a warning sign based on body type that parents should be looked out for?
You know, there's no really good scientific data where a body type, however you want to define that, can predict the eventual risk of an injury. Because you can have the most musculoskeletally sound, chiseled athlete, youth, adolescent, and say, you know what, that kid is an athlete, so you're going to expose him to more risk. He's going to be out playing more because he's a better athlete, and by playing more, you're exposing him to more risk. So if you look at who hurt their knee or shoulder or ankle, more than anybody, it's the well-chiseled, talented individual. And the less chiseled individual, that less talented, he's going to be sitting on the bench, not exposed to an injury. So there's a balance, between all this that parents and coaches and athletes need to be aware of.
That's good. Are there any general guidelines that could be provided for parents on how much is too much? Like if you have a baseball player, it's a 6-month season. I mean, is there any type of general?
There's all sorts of guidelines, and this is what this STOP program, stopinjuries.org website will provide parents with. There's a plethora of information out there that can help a parent make informed decisions about how much is too much. And they just need to get on their computer and go there.
Okay. Last question. What would be when it comes to injuries, what would be the take-home message for parents and volunteer coaches? The one thing they need to be aware of when it comes to
there's a tremendous benefit playing sports. We should encourage more and more kids to play sports. But there's such a thing as overuse, overdoing it, and it's independent of the sport. Any sport could involve a situation where there was overuse, or too much repetitive stress, and I think it's the obligation of coaches and parents to educate themselves on what situations can eventually lead to that.
That's perfect. Thank you very much.
You're welcome.